Now I have the honor of introducing and moderating our next panel using children's books to discuss race and racism. So we have three incredibly talented experts here with us today. We have Shauntee Burns-Simpson, who currently serves as the president of the Black Caucus of the American Library Association. She's also the associate director of school outreach at the New York Public Library. Jill Eisenberg is the Senior Director of Curriculum and Literacy Strategy at Lee & Low Books, the largest independent children's book publisher specializing in diversity and multiculturalism. After serving as a Fulbright Fellow in Taiwan, where she taught English, she was an ELA teacher for third grade in the Bay Area in California and has been passionate about the best practices for supporting English language learners and parent engagement ever since. And finally, we have Dr. Rajani LaRocca, born in India, raised in Kentucky, and now lives in the Boston area where she practices medicine and writes award-winning novels and picture books, including Midsummer's Mayhem, 7 Golden Rings, Red, White, and Whole, Bracelets for Venus Brothers, Much Ado About Baseball, and many more. So welcome all three. Thank you so much for being here today. So I'm going to jump right in, and my first question is going to be directed to Rajani and Shauntee. In the last panel, we spoke a lot about the importance of trust. How does the concept of trust fit into our healthcare system, which we know is systemically racist?
So I can start. So I should just note that I am an internal medicine primary care doctor. So I'm a doctor for adults, but I write books for kids. And to me, trust is at the heart of the relationship in healthcare, because you can give all the advice you want, but if there is no trust there, then why would anybody listen to you? And for me, in my experience, trust begins with listening to the person who comes into your room and understanding their point of view, and then explaining your point of view. So I think that's the heart of it for me.
I totally agree. African Americans have a dim view of the healthcare system. A nationwide poll by the Kaiser Family Foundation was done at the end of 2020 that found 7 out of 10 African Americans believe that people are treated unfairly based on race or ethnicity when seeking medical care, which means the discrimination that they feel at work, shopping, in school, or even by law enforcement is the same experience that they feel when they go to see a doctor, which is unfortunate. The Pew research shows that 69% say their local libraries contribute a lot to providing a safe place for people to spend time. So promoting a sense of community among different groups of people is how many people view the library. We are viewed as very trustworthy amongst different groups. So now the question is, how do we do that? And that's a great question. We provide resources and programs for diverse communities. So that's the question we want to ask hospitals and medical offices. Do they make their communities, the people who come in their doors, feel welcome? Does your hospital or medical office reflect the community? Is there staff that speak the language? Are there signage, flyers, forms, and reading materials available in a variety of languages? And are there programs there that address your patient's needs? These are the things that will make people feel comfortable, that will make them feel like they can trust you and feel welcomed.
Thank you. So a bit of a follow-up question to that, open to all three. So, Shauntee, you mentioned a few ways that pediatricians can really help build and create the safe space to, first of all, just feel welcome, right? But we're also within the Reach Out and Read program, opening up this conversation of race and racism with the children and the parents and caregivers that are their patients. So how would you recommend building a relationship with families to get comfortable with these conversations, especially across racial lines? Shauntee, we'll start with you, and then Rajani, and then Jill.
Okay, so I mean, many of my library colleagues, we could tell you that folks don't come right into the library and ask for the information that they want right offhand. Like many times people really come in, they won't even go to the information desk. And if they come to the information desk, they start off with, general questions, and sometimes they don't even know how to ask the right questions. So that's where librarians are trained to drill down to get to what the patron wants. We call it the reference interview. I would correlate it to doctors' bedside manners. A patient will trust the doctors who they feel like listens and understands where they're coming from. I'll say cultural competence is key. You want to understand the community you serve from knowing their beliefs and attitudes towards certain things, which is important for patients to trust your recommendations. So I would also want to point out consistency is also important. Because we do see many of the same kids and families, whether they come in every day after school, or if they come in every few weeks to return their books or for a program. It's that consistency that helps gain the trust. And I believe it's the same for pediatricians. So if you see the same families for your wellness visits, it will help establish trust, and you see that child from birth every, 4 to 6 weeks, and you're sharing those milestones with the parent. It's at that time when you can share what's best for the child and hear what's going on with the family, and that bond is forged. And that's where you're able to have those challenging conversations, the conversations around race, or a new sibling coming up, just different things that parents might not know how to foster the conversation with their child. It's at that time when you've established the trust that you're able to have those difficult conversations. And I'm just going to put it out there that books are the gateway to doing that. I do have some samples, but I know that we have many questions to answer. So if we have time, I will show those off.
Thank you. I love the comparison with the reference interview to bedside manner. I think that's an extremely accurate comparison. Rajani, what would you like to add?
So I'm going to echo a lot of what Shauntee said. So first of all, I think that, one way to build trust and to address a kind of issues of systemic racism is to make sure that the places where we practice reflect the community that we practice in. Now, I work in a community health center, so I have a particular bias towards that. But I think that everyone who works in a particular healthcare setting, we should work as administratively to make sure that it reflects the community that we live in. And I would also say that one of the best things about being a primary care provider is that we get to see people over time. And Shauntee is absolutely right that it is over time and seeing people consistently that we build that trust and that they're willing to listen to what we have to say, and that we need to make sure that we're still willing to listen to what they have to say. Sometimes these conversations, if you don't listen to people's answers, or if you don't ask why they feel a certain way, you will never get to the part where they reveal that it's something about their family beliefs or cultural beliefs or whatever, their community, that is a barrier to what you think they need to do in terms of health. And, you know, for example, I had a patient who didn't want the flu vaccine and was clearly high risk, needed the flu vaccine. And I said, well, why? And she said, well, people around me are saying that it's dangerous and that, like, you know, it's not good for us and that we're getting a different flu vaccine from everybody else. And I said, oh, okay, well, I hear you. I would be concerned if I had heard that too, but let me just tell you, it's the same vaccine that I took, and I took it, you know, 2 weeks ago and I'm fine. And then she said, okay. So, but if you don't ask why, you may not get to the why I don't want to do something. And I agree that books are marvelous vehicles for opening up these conversations, because by reading a book, you can experience someone else's experience, and you're a little bit removed from it. So something that might be super difficult, you can find a way to discuss because it's about somebody else. And you're looking at it. That's the other thing that I would say, is that in healthcare, we're so used to normalizing difficult conversations. We should be able to have difficult conversations. We need to think about racism as part of the difficult conversations that we have routinely, because the first step to addressing anything is to acknowledge that it exists.
100%. Jill, is there anything you would like to add?
Yes. I mean, there's so much that is absolutely, I mean, I agree with here. And, you know, I recommending in terms of with pediatricians of, first off, recognizing that the trauma and experience of racism that many of the family or caregivers might already be coming in with from their prenatal and their delivery care. And so before we can turn around and ask caregivers to have these conversations and embark on this journey with their kids, to think about what resources they need to do their own healing, their own processing, and also getting better care. Secondly, you know, taking a look at recognizing as a pediatrician, there are many people, and while there is definitely mistrust in the medical establishment, there's also, you know, recognizing this power imbalance around the role of a pediatrician. I mean, people still do deeply respect and can often still defer to a doctor, and recognizing how that is both an asset, but it can also be, you know, a barrier to having really honest conversations. And so thinking about how can you engage the nurses or other parts of the staff in your office to also have these conversations, to also make families feel that this is a place that they can be honest, they can bring questions, they can ask for follow-up of how to best support their family and their kids. One of the other pieces in terms of talking about trust, you know, if you're bringing in books as a way to have these conversations, you know, thinking about how instead of being the one to choose and think, you know, the books that your kids and the families are going to be excited about, possibly allowing the caregivers to do that, you know, pick from 2 or 3 books, what books are they drawn to? And then if the kids are old enough, to let them pick the book as well, because that helps remove you making that decision of making assumptions about what your community and your family's like. And also there's an empowerment piece too of just the excitement and joy. You're further invested when you got to pick this book. You know that this is something that you're going to like and really speaks to you. And oftentimes that will be surprising of what people are drawn to and what topics kids really love. It's another piece that I think I really want to touch on that has been discussed here is really the key piece of explaining why. You know, why talk about race and racism with your families in the doctor's office? Why talk about literacy in the doctor's office? You know, really helping people understand, you know, pushing beyond maybe their own misconceptions they have, but really saying like, this is a place that, you know, this is a whole community effort to talk about race and racism as well as children's literacy. We can't just leave it for the classroom. And all of these conversations, hopefully, in terms of building trust, really help you know, parents and caregivers really recognize from the beginning that they really are their child's truest educator. You know, most classroom teachers are going to be with your child on any given year for 10 months. But if you're working with these having these conversations now with parents around racist racism or other topics about health, nutrition, and literacy, we really want parents to recognize you are the advocate for 13 grade school years or beyond. I mean, extra 5 if we're looking at 0 to 5. And so this absolutely are conversations that should be happening in the pediatrician's office.
Thank you, Jill. Yeah, it's so important. So this is a bit of a follow-up question, and I'm going to direct this first to Rajani. What advice or resources do you have for healthcare workers who feel that this conversation is not their responsibility in their profession?
So what I would say is we as healthcare providers, we only see people for a very small amount of time. Like we may see them over time, you know, every month or two and then every year or so. But the vast majority, 99.99% of what happens to your patient's health happens at home, at school and at school. And we need to recognize that, right? So if we know that the social determinants of health are extremely important. So we as a medical community must recognize that racism, you know, contributes or is a drawback to our patient's health. And so just like we ask difficult other questions about safety, about seatbelts and firearms and things like that, we need to be engaging in discussions about this. And we as healthcare providers need to talk to the folks in charge of our practices and our hospitals, because we're on the ground seeing people, and the change needs to happen at all levels, right? It needs to happen in discussions between doctors and patients and families, but it also needs to happen from an administrative level. Like, what is our healthcare system doing to change things so that our patients can all be healthy?
Thank you. So shifting, it's so important. You know, I think everyone in all of the panels today has talked about the importance of getting everyone on board. And I'm seeing that echoed here today as well. So that's something that, you know, to take away from this. So shifting conversations a little bit back towards the books. First, I will ask Jill to answer, and then Shauntee. Can you talk about how introducing early literacy concepts can help battle against systemic racism, and how can children's books be used as part of this conversation?
Sure. So as it's been mentioned earlier, I mean, books provide a really great medium. It can be removed enough where you can have a conversation with a child where it's not directly about either something that they've directly witnessed or experienced, or they're grappling with. And so it's a little bit safer where you say, like, how did this character handle it? Was this the best way to do this? Or, you know, and explore it in that space. But it's also an incredibly intimate medium where you really can get into how it does connect to what is going on in your family's life, what kids are seeing, what kids are experiencing. You know, the authors and the illustrators have worked very incredibly hard to take complex, sensitive, very loaded subjects and break them down in developmentally appropriate ways. They can often give language for kids who don't have the words yet to really express, you know, these big emotions, these big experiences that they may be seeing or feeling, as well as it can kind of give a guide to parents on how far to actually go into the conversation where kids will still grapple with it. You know, how can you keep it concrete, you know, without getting overloaded with lots of metaphors that might get over kids' heads, or go farther than they're really asking you about. So books really do provide this really great space for parents as well as, you know, healthcare providers to start those conversations and really help lower the barrier to entry to really talking about race and racism with kids, even at the youngest ages.
Thank you, Shauntee. And maybe now would be a good time to share those example books.
I know, that's what I want to do. So of course we know read, sing, play, talk, and write. For parents, educators, anyone who wants to work with kids who want to open up a dialogue about racial identity or racism, children's literature provides an excellent starting point. Well-written children's books allows children to identify with and develop empathy for characters who may or may not look like them. Adults can then take what was read to start a dialogue with the child. It's important to have children's books that represent a diversity of people and experiences. Providing books that allow children to see themselves in the pages offers the kind of high interest materials that support children's early literacy. So again, we all know it's never too early to read to a child. And when children are learning to read, it's important for them to be able to select books that allow them to feel a connection to the content. and as well as learn about the world that they are a part of. And I have 3 examples. So the first one I want to show really quickly is this one, All Because You Matter, Love. I just want to point out some parts of the story. I mean, with the social unrest that was happening, that's happening across the country, unfortunately, books like this really, really is great to read to your child. The pictures are amazing. Let me just read a snippet. It says, and you hear Pop-Pop's whispered prayers as another name is called, Trayvon, Tamir, Philando, and you wonder if they or you will ever matter. And then that's when you have a question to pose. But it's the ending for me, and I hope I don't get choked up. I mean, I read this book all the time to my kids. And on the day the universe was created, you were thought of, dreamt of, carried like a knapsack full of wishes as planets, stars, moons took their places, making room for you, your people, their dreams, your future. All because since the beginning of time, you mattered, they mattered, we matter, and always will. Is that not a gateway to a conversation? Then you could go into nonfiction, Little Heroes of Color. And these movers and shakers and history makers from many walks of life will show your little scholars there's nothing they can't do. So again, being able to talk about real people that exist and let them know what they contributed to the world. But it's also really, really important to just read books about everyday experiences. And this is my 8-year-old's favorite, Jabari Jones. And this book is about a little boy, Jabari, who learns how to swim. His dad takes him to the public pool, and he decides today is the day he's going to jump off the high diving board. And let me just show you and read a snippet. Jabari took a deep breath and felt it fill his body from the ends of his hair right down to the tips of his toes. Jabari looked up. He began to climb up, up, and up and up until he got to the top. Jabari stood up straight. He walked all the way to the ends of the board. His toes curled around the rough edge. Do you think he was brave enough to jump? You'll have to read the book to find out. And this is why books are important.
Amazing. Oh my gosh. You may have not gotten choked up, but I did a little. Thank you so much for sharing those. We're seeing a lot of comments about how wonderful these books are. Jabari Jump seems to be a favorite among a lot of people, which is fantastic. Other people saying they're also teary. So now I want to take the opportunity. We have, our 3 panelists today come from 3 different backgrounds. And so I want to ask each one of you a pointed question on using your expertise in your field. So first, Rajani, how has being a doctor influenced your role as a children's author and vice versa?
So I love this question. I actually get this question pretty often because people are like, wait a minute, what? And I'm like, yes. I'm an internal medicine doctor and I write books for kids. And I will just say, first of all, that as a child, I never saw myself in a book. I still loved books. So I think that goes both ways, right? One is that it's important to have books so that children can see themselves in books, whether they look like the characters or just feel like those characters, right? But the other thing is that I think it's a disservice to think that children can't like books about people that don't look like them. I think that's just not true. And so we need all readers to read books about people that are like them and not like them. And that means that sometimes they find out that the people that don't seem like them really are similar to them. So anyway, I will say that there are lots of things in common between practicing medicine and writing books for children. Some of the things include observational skills, right? So in medicine, we're trained to ask questions, but also to observe. And in writing, we do the same kinds of things in order to make characters seem real. We have to, and places seem real. We have to use our observations and kind of put them on paper. We work in teams in both fields. I couldn't do my job as a doctor without all the amazing people that are working with me, all for the good of our patients. And similarly, as a writer, I couldn't do anything without all the people involved with the publishing process. But really, for me, at the heart of this question is that both medicine and writing have to do with people. People who are wonderful, people who can be awful, people who can be so brave, and people who can make terrible choices. And as a physician, my job is to listen to my patient, to meet them where they are, and try to help them prevent illness or to treat the illness that they have. And as a writer, my job is to create characters that really communicate emotional truths. I can write the most fantastical story, but the important part is to capture some of true human emotion and experience in what I do. So at the heart of both things is a love of people and a wonder about the world.
Amazing. Thank you. Yeah, I never would have thought there were so many similarities, but it makes sense. All right. Over to you, Shauntee. How can librarians work with pediatricians to help combat racism?
Well, I mean, we can help by supporting your work with your patients. I mean, your patients are members of the community, the same people who come to the local library. We can provide book recommendations to be able to help you have these conversations around race and any other topics with your families. So I would like to highlight that the New York Public Library has the best books for kids, and this is an annual list. I also want to point out that the Black Caucus of the American Library Association has the best of the best book list. And you could find both of these book lists, the New York Public Library's Best Books for Kids on nypl.org. And then you can find the Black Caucus of the American Library Association's list, the best of the best, at BCALA.org. Along with that, we could provide guided questions to go along with the books that you are handing out, as well as doing programs and parent workshops with your families to help them pick out books to read with their kids. Because I find in the library, parents do feel a little lost when it comes to picking out books, and I get it when you go to schools and they level the books, and then you go into the public library, you assume that the letter on the side of the book is the level, and is actually for the author's last name. So it can be a little confusing, but also letting parents know that it's fine for the child to pick a book. And it's fine if they pick a book that's a little challenging. That means that you have to read it together. And it's also fine if they read the same book over and over again. I mean, it's nothing wrong as long as they're reading. So we just want to support the pediatricians in their work with the families, and just invite us to come to when things are normal, to come and do a program in your waiting area. I mean, it's just important to make sure that families are reading.
Thank you. And then our final question that we have prepared today goes to Jill. What role does the children's publishing industry play in combating racism? And how does this apply to the work done in community-based organizations like Reach Out and Read, or the libraries, or any of the other organizations that are present in our attendees here today?
So, Lee and Low Books has been focusing on exploring race and ethnicity, LGBT, and many other aspects of identity of our families and kids for over 30 years. But, if this past year has been any indication how much farther publishing as an industry has to go, there has been, some incredible books that have won awards and have come out. I mean, sometimes when publishers do want to move quickly, we can get a book out in several months. And so that's been really powerful to see where can books fill the gap in the conversations that families so badly and teachers so badly want to have right now with their kids, and are being super courageous, even when they're left to Zoom, to have these conversations with kids. A big piece where publishing still needs to go, particularly around race and racism, is thinking about, what types of narratives are consistently being told in your own catalog as a publisher. Where are your own gaps? Are all of your books featuring characters and historical figures of color only covering up narratives of overcoming oppression? Or are they, as Shauntee's showing, having books about joy and celebrating kids being kids, and kids, struggling with universal children's problems as well? Because, what's it like to change grades, get a new sibling, have to move away, say goodbye to a family member, losing a grandparent. So how can publishing continue to think about what stories should be told? And again, it shouldn't come top down. Publishers need to continue to do better about listening, as well as building trust, not just, when we think about pediatricians and the healthcare world of building trust with communities, but also publishers. As an industry, we need to do a better job of building trust with communities who have been historically underrepresented or misrepresented in books, and making sure that when publishers are engaging, new authors, as well as communities that have been historically out, and also maybe even geographically are distant, they're not in New York City, the heart of publishing. How can we make sure that we're creating stories that are relevant to kids today, and what authors, see that they wish that they had when they were younger? And when we also look again, each year we get really excited to see across as an industry the progress, the incremental progress that is being made to address the diversity, but it is so uneven across genres and age groups. And I imagine, for all of our healthcare, if you're working and seeing kids' books, it can be really hard to find the right books at 0 to 5, and this is where the public libraries and the school libraries in the community do come in. I mean, these are some incredibly trained, they spend years getting so many higher degrees to understand children's literature, to really be able to pick out the best of the best. I mean, the children's awards, they look for accuracy, they look to make sure, that everyone is represented authentically. And we will totally get called out even still, just like, hey, where are the missing bibliography and the resources here? And that keeps publishers A, on their toes, and B, it benefits kids and teachers and parents. And I always encourage not just classroom teachers, but very much, pediatricians and healthcare to utilize the libraries, because they know the new releases, they know the backlist, they know everything. So don't feel like you have to go and invent that and figure out that on your own. The last piece I would say that the role publishing industry can do too is in creating these books. Oftentimes it's like, oh, our job's done, we published the book, it's out. But throwing it into the wild and hoping people know how to use it, that's a really big missed opportunity. And so, if there are, partners that can immediately line up for that, whether it is with a nonprofit or it is with a curriculum organization, to create a resource to help families, to help teachers know where to start, or, maybe additional background information the adult needs to be able to navigate that book. Fantastic. That is going to ensure the success of the book. It's going to give everybody confidence. And so we can't stop there. And then I think then the last piece too is I mean, there's a lot of areas for publishing to continue to grow, but, I think the language equity is a huge, huge piece. And that includes resources. If as pediatricians, you're going to hand out any web links or physical copies of any handouts, making sure that there is, materials in Chinese, Vietnamese, Arabic, or Spanish. That is just something that, continues to be something that is in such huge need in classrooms and in families' home libraries.
Amazing. Thank you. Yes, 100%. So I see we have one question in the audience, but before I go to those questions, I want to make sure if are there any last things that you wanted to say but didn't come up in the questions that you feel should be said before I call on Dr. Ella Jean Richards-Francois.
I think Jill said a mouthful, and I'm in 100% agreement with everything you said. And I'm glad that the publishing is really listening to what we're saying, because we do hold you to it. We're like, we need more, and we want more. Our communities want more. And I think what was like not true was the fact that Black and brown folks won't buy books. These are all my personal books. I mean, I am a librarian, but still we buy books. We want our kids to be able to learn and flourish with, like everyone else. So I think that was just something that was said in publishing and shared for many years. And I think the more that we go out and purchase books for our family members and for our friends, and they'll see the power in the numbers of these books flying off the shelves. And I also know that many of the bookstores weren't sure how to market these books. And again, just like the public libraries, we do not just market Black and brown people on the cover just during, the month of February. This is something that needs to be marketed all year round. And I'm not just going to talk about Black and brown books. I'm just speaking from my perspective right now, but all books, all characters, we have to make sure that we are promoting them all year round. So thank you.
And I wanted to add that, as much as we think about a popular culture, and I include books in that definition, reflecting the world around us, I think we can't underestimate how much popular culture, especially books, help create the world that we want. So that's why it's really, really important to continue telling all kinds of stories about all kinds of people that overcome struggles, but also people that just experience joy and celebrate that, because that's how we create the world that we want.
You're absolutely correct, because a good story just translates to everyone. So it's not that one family is going to leave with one book based on who's on the cover. No, it's about the story. So thank you for pointing that out. You're absolutely correct.
Amazing. Yes, lots of agreement in the chat happening. All right, so Ella Jean, I'm going to unmute you. Can you please ask your question?
So there's so much like flooding around in my mind that I have to try to get it out quickly and concisely and clearly. So just bear with me for a moment. I'm a pediatrician. I work in Brooklyn. Our community that we serve is 90% African, from the African diaspora, from African immigrants to Caribbean immigrants to Black Americans. And the children absolutely love the books. The way we use the way I have been using the books, and I'm the reader coordinator, so I encourage my colleagues to do this similarly, is when I see books with Black boys on it and with the curly hair, I make sure that my Black boys see themselves on a cover of one of the books that they're going to receive. When the studies came out showing that boys were less likely to be able to recognize emotion and when they're reading a story, you guys had given out a book called Feelings, and I made sure that the boys received that and taught the parents to show them in all the books that they read, to identify the emotions and try to help the children identify the emotions in whatever book they're reading. So, you know, as we hear the literature and as we train, because we're, you know, I'm on the faculty of the medical school, and cultural sensitivity is on the curriculum and it's throughout the curriculum. So a lot of the things that you brought up here are things that are being addressed in the next generation of doctors. And that's, you know, that's inspiring and good to know. One thing, the question that I had, and I think Reach Out and Read has done a wonderful job of making sure that we have a variety of books. I'm going to use this moment to plug my pet peeve that a lot, even though my last name is Francois, I only took French in school, okay? But a lot of our community is Haitian immigrants and we still don't have any Creole books. So we need some Creole books, please, please, please. And since we have somebody here from a publishing house, please, we need books in Creole, thank you. But one of the questions I had was the illustrations are so important. And we haven't really spoken that much about illustration. There was a book called Bounce Baby Bounce that one of my colleagues brought to my attention, and she was concerned about the book because of the illustration in the book. And we ran it up the chain. I contacted my Reach Out and Read coordinator and they promised to look into it, but we never heard anything back. So and then on another shipment, we asked to not receive any more of the books. And then on another shipment, we did receive the books. And I said, well, you know, I never really got feedback on what happened. And, you know, the coordinators change annually. So that line of communication had kind of been cut. Can you just speak to is anybody looking at the illustrations and what is the feedback loop? How do you close that loop? When somebody raises a concern, how does it get elevated, escalated, and then how does the feedback get back to us?
Yes, so great question. I know that Reach Out and Read of Greater New York has undergone a significant amount of turnover over the years. And that the regional coordinator position is a one-year fellowship position. That's actually something that we are changing with our next hire. Michael is fortunately and unfortunately leaving us for medical school. And so but that position will now be at least a 2-year position to create a greater consistency. And then one of the pieces, you know, I'm still new. I'm almost exactly a year in to the day. But I will say I got my start really in my career working at the New York Public Library, actually with Shauntee. And so this is, and I'm a part of the Association of Library Services to Children, where we create book lists and look at everything with the diverse eye and problematic pieces. And so first, let me say I'm sorry that your feedback never went anywhere. I know that that's a problem and we will fix that. Right now we're working with Lee and Lowe specifically for this reason, because we do want to see better and more diverse books in the hands of the patients. But I will say too, one of the challenges that we face is that unfortunately diverse books tend to cost more money. And so our budget for years has been $2 a book. And diverse books, we're looking at closer to $5.50 per book. And so that is more than double of what we've used in the past. And believe me, I promise you, Emily is working day and night to fundraise and to make this a real possibility, as is our board. But I also want you to know that I will promise that if you send me a book that you no longer want to receive, you will not receive that book. We had something happen similarly with 5 Little Monkeys. A site removed that book, and that is no longer a book that we order or recommend that anybody else orders. And so I can promise you going forward, it's going to change. But also please, if you notice something and it doesn't, please call us out, because we need to be called out so that we can change. So I really appreciate you bringing this to our attention. And I do.
I want to add on to, and I'm not familiar
Yes.
with Bounce Baby Bouncer for this book, but if a book is decided, like, it has been flagged and it is problematic, and either illustrations or any terminology used in the text, not only have that potentially removed from the collection, but definitely let the publisher know, saying like, hey, we are paying attention, we know what we want to put into the hands. These are our doctors are getting back to us and saying this is not what we want to see, do better. Because publishers will, even when working with nonprofits, you guys are customers, and absolutely we want to make sure, and should be making sure that we're putting the best and most accurate books, that we're not sitting back and just like, well, it's sold in the past and no one asked questions. That's not okay. I know when we work with schools and districts, sometimes if the books that we publish I make certain community members, uncomfortable. They're not ready to have these conversations with their kids. If a curriculum organization or a district lets us know, we're happy to provide further information. Again, don't know specifically about Bounce Baby Bounce, but if there's maybe more cultural education that needs to go around a particular book, of like what resources, again, whether it's a guide or connecting them to the author to get more thinking around why the book is presenting and depicting characters the way they are. But absolutely, I mean, thank you for bringing that up, and continue to do so, because this is how we all continue to make better books and hold each other accountable of what kids are going to be taking home and putting on their library. And as we know with kids, I mean, they're going to be reading these books potentially 100 times in 1 year, so every book in their home library counts.
And you're right, when we are picking books for book lists, we do consider the images, because we want to make sure that these images are not portraying any, stereotypes. So
Yeah.
Definitely pictures matter. And that's why I want to show you the book, because we do judge the book by its cover. So
100%.
You're right on with the photos.
So we have another question from the audience, and only a couple of minutes left. So some of the providers I work with have expressed concern about giving out some books like Round as a Tortilla and One as a Piñata that may be representative of Hispanic or Latino ethnicity, but not necessarily reflective of a more specific cultural identity or family country of origin. Many of the families we serve are of Dominican descent, and these themes may not speak to them. What do you suggest to do in this situation? As a concern, thinking about representation.
You want me to? I'll start for sure. I mean, that's absolutely something that we talk about too, in terms of when you take a look at the books that, again, your center, your hospital, your healthcare facility is receiving. So allowing, I don't know in terms of the whole reach out and read process, if you're able to submit, demographics or give estimates of the community members that you're serving and what books you would be seeking. But asking, as you're building those collections from the publishers, how specific can they provide information on the books of, if you're looking to see more books in Creole, or you want to see more books with families from the Caribbean, how can we make sure that those are a bigger inclusion? We absolutely definitely, know that, particularly if you're looking at books like for Latinx, that is such a broad category, books set, for Mexican Americans on the border of California and Mexico versus, in Harlem and or Puerto Rican and Dominican descent, how do we make sure that the books are representative to those communities, as well as, an opportunity to learn about others, but making sure that this isn't the one narrative that they're seeing about a community or a culture. But then in addition, also thinking about if, we definitely see this as the books get older, and you explore more nonfiction too, of if you're showing books where families and communities are always featured in like one narrative, is every Latinx book that you're putting into the hands of your families an immigration story? Maybe that's some people's stories, but that is definitely not for an entire community. Similarly, if you're creating and curating a collection around African-American stories, are they only civil rights stories? That is a big piece, but what other pieces of African-American history as well as contemporary life can we be featuring? Yeah, no, it's big.
No, you're right, Jill. And the fact that if you are just displaying one type of Spanish book, then again, the community seeing that they don't get us, they don't understand who they're serving, which is unfortunate. So yeah, when you're giving out materials, you have to make sure that it is the materials that your community wants and will appreciate and respect. I'm not saying that they can't read other materials, but you also have to be able to provide materials where they see themselves.
And I will just put in a plug to anybody out there who is a writer or an illustrator or a creator, that no culture is a monolith, and we need all the stories. So if you have a particular story that is your story that you want to tell, or a story you know well that you want to tell it. We need it.
100%. Thank you. Thank you. So we are at noon. And so I just want to thank everyone on this panel. Thank you so much for sharing your experience and your stories today. We truly appreciate it. I know we didn't have a lot of time for questions. And so if anybody would like to email me questions, I will send them out to our panelists that didn't get answered. And we will make sure to get your questions answered. So thank you just so much to everyone here who joined us, attendees and panelists.